When I moved into operations, felt like things were not so organized, that there wasn't a lot of systemness to the way that operations improved. Back probably in 2005, the CEO was talking about how lean, was what they were going to use to save patient lives, and it was so impactful to me. It was like angels sang, and I knew it's so simple, and yet it could have like such a huge impact.
And so we created the Denver Health Lean Academy. It became this really powerful asset inside of Denver Health to arm our leaders with the necessary tools and skills to be successful. There are dozens of places across our system where you can go and you can see real work, real thought, using systematic thinking in problem solving across Denver Health.
NICU nurses are notoriously A-type personalities. They like structure, they like black and white answers, and lean plays right into that structure. It's all about having the staff's input and having the staff be the ones who are making the decision and sharing the information. The staff would come in here and the charge nurse would have a sheet filled out in front of her that would say who was here for the day, and then it was like a long typed out list of things that they needed to know. And so if she got busy, the nurses might be getting the same information for 2 or 3 weeks at a time. Whereas when we went to this format, the nurses can kind of saunter in and get the information off the board that they need to. So it's much more interactive. Recently, I had a staff nurse who said, I want to start making discharge phone calls. And I was able to take some of those tools off the shelf and say, okay, here's where we start. And she's been doing great work with that. Like, she uses a lot of visual management, red and green dots to tell when we're making the calls and when we're not meeting our goals. And it's really fun for me to, not only did I receive that knowledge, but now I can share it with the staff.
We have 36 ambulances to cover the entire city and county of Denver. We ran 100,000 calls last year. So we need to do this as efficiently as we can. About 10 years ago, we would have cars that were assigned to specific crews. The same ambulance was used by the same crew. They would get a half an hour to stock their ambulance, which meant that there was an ambulance that wasn't going to be able to respond to that call for a half an hour. In emergency medicine, that half an hour could mean the difference between life and death. So the first thing we did was decide to alternate our ambulances. So when a crew comes in now, they'll have a randomly assigned ambulance. We decided that we wanted vehicle support technicians. Our VSTs get the ambulance ready for the crews so that they're able to just go out with a fully stocked ambulance and not have to worry about stocking it or restocking it. We've been able to solve the problem of not having ambulances go into service because they're on a late call. We've resolved the problem of cleanliness and proper stocking. By having the VST stock the ambulances, crews are ready to go at the beginning of their shift, or sometimes they'll leave the garage before their shift even starts if they need to take a call. Since we've started the Lean program, this garage has been reconfigured at least 10 times. As we find new processes, the garage flow will change, the equipment will change. You can't be afraid of change because it always helps us to improve.
This notion that we're creating a learning culture and that we are helping leaders be vulnerable and say they don't know everything, and that there's a space where they can come learn and begin to know is an incredible cultural enabler to change. That, to me, is a huge success, is really changing that people culture.